Early kidney cancer symptoms. Dr. Himesh Gandhi, robotic surgeon and consultant uro-oncologist. Early kidney cancer often does not cause noticeable symptoms, and it is frequently detected incidentally during medical tests for other unrelated conditions. However, as the cancer progresses, it can produce symptoms. Here are some common signs and symptoms associated with early-stage kidney cancer. Blood in urine. Hematuria. One of the most common early symptoms of kidney cancer is the presence of blood in the urine. Hematuria can make the urine appear pink, red, or brown. It may be visible to the naked eye or detected only under a microscope. Lump or mass. Some people with kidney cancer may feel a lump or mass in the side or lower back where the kidney is located. These masses are often painless. Pain or discomfort in the back or side, just below the ribs, can occur as the tumor grows. This pain may come and go and may be mild or severe. Fatigue. Unexplained fatigue and a general feeling of weakness can sometimes be associated with kidney cancer, although it is a non-specific symptom. Weight loss. Unintentional weight loss can occur as the cancer progresses. This can be due to a combination of factors, including loss of appetite and the body's metabolic response to the cancer. Fever and night sweats. In some cases, kidney cancer can cause fever and night sweats, but these symptoms are less common. It's important to note that these symptoms can also be caused by various other non-cancerous conditions or diseases. Additionally, kidney cancer symptoms may vary from person to person, and some individuals with early-stage kidney cancer may not experience any symptoms at all. If you notice any persistent or concerning symptoms, especially blood in the urine, it is essential to consult a healthcare professional for a thorough evaluation. Early detection of kidney cancer can lead to more effective treatment and a better prognosis. Routine medical checkups and screenings can also help detect kidney cancer in its early stages, especially in individuals at higher risk due to factors like a family history of the disease or certain occupational exposures.